Breaking news! Derek Ramsey fractures his wrist and hand during commercial shoot for Nestle Fit. Let's watch this.
Get hot. Stay hot.
You can by maintaining an active lifestyle and drinking Nestle Fit, the affordable low-calorie iced tea with L-carnitine.
Easy maging hot.
Getting hot is this cool.
Let's see that again.
Now let's discuss what happens when the radius bone of the wrist is fractured or broken. The wrist can fracture in many different ways. The radius may fracture just above the wrist joint. This can also be coupled with a fracture in the ulna. In other cases, the radius may be fractured in a way that damages the articular cartilage on the joint surface. Notice how this makes the smooth surface of the articular cartilage become rough or jagged. Fractures such as these can be more serious because even a little roughness or irregularity in the joint surface can lead to painful movement of the joint and the early development of arthritis. In most cases, surgery allows for roughness on the joint surface to be returned to its original or near original smoothness. This offers the greatest chance for the return of normal function. The carpal tunnel is on the palm side of the wrist. When a bone breaks, there is bleeding and swelling at the site of the fracture. If the radius bone is displaced from its normal position, it can place pressure on the median nerve in the fixed space of the carpal tunnel. This pressure can damage the nerve and result in numbness or weakness in the hand.
Hi, I'm Dr. Ryan Calfee with Washington University Orthopedics. We see many patients with hand fractures at our outpatient center in Chesterfield as well as Barnes Jewish Hospital. Patients with hand fractures often present with continued pain, swelling, and bruising following an injury. Sometimes, if the fracture is actually out of place, people's hands will not close right, and instead of making a full fist, an injured finger will cross over an adjacent finger. We try to individualize our treatment of fractures on each patient. For teenagers, this will often mean a cast to protect the hand from being injured or hit at school. For the older individual with the same injury, we will treat them with a custom splint to begin early finger motion so that the hand does not get too stiff when there's pre-existing arthritis. When fractures are out of place and need to be repaired, we will often perform surgery using either plates and screws or pins to restore the hand's function. And as always, if hand or wrist pain persists for several days after injury, it is always important to seek medical attention.